Hi everybody, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to do a quick video about my opinion of where the future of healthcare is going. I had a very loyal viewer ask me about this, and I think it's a very valid question, although the future is so unknown to everybody, right? But having been in the field for so long and kind of seeing where we came from and what's going on right now, I do have some, I don't know, some is opinion, some is guessing, but I'm going to be very honest with you, I could be way off. But basically, I really think that until somebody starts cracking down on the healthcare insurance companies and the pharmaceutical companies, that we're going to continue seeing a burden being placed on patients with costs, and we're also going to be seeing that burden being placed on providers, especially small practices. Now, I was in medicine, healthcare long enough that I've seen the pendulum swing quite a bit, where when I got into healthcare, there were a lot of private practices, they were doing well, and that's what everybody loved. And then as soon as, I would say, probably the requirements for electronic medical records came in, and in order to be able to hit certain measurements and expectations with the MACRA and MIPS, we started slowly seeing those providers either retire and close their practices, or we saw them leaving their private practices and they started going to big entities, hospital affiliated clinics, hospitals, etc., because it was getting to be too much administrative burden. It was getting to be too costly and too much of a headache. So you had those people. And then, we started, I would say probably about 4 years ago, started seeing that pendulum starting to slowly swing back into private practice, because people kind of realized it wasn't as great working for other people telling them what to do. Working for a big company, corporate medicine wasn't really what they got into medicine for. So they started being a pendulum swinging back to private practice. And then after all of the requirements and regulations during COVID, it started really accelerating back into that private practice. I know locally in Oregon, or at least in the Portland area, there have been a lot of doctors again that have retired because they're tired of medicine, but also they are now leaving those big companies and they're like, I want to be my own boss again, I want to run my own practice, and they're coming into it. The problem with that is they weren't used to, over here when they had their own practice, having to have as many administrative burdens, requirements, compliance, healthcare, insurance, niches or complexities, and now they're realizing as they're in their new practice or starting their new practice, it's even more overwhelming than it was before because of all the new stuff. And unfortunately, these compliance, these regulations are coming down on the places that I don't feel they should be, and they're actually avoiding where it needs to go. And to me, that's the pharmaceutical companies and the insurance companies. So you're feeling this heavy weighted burden even more in practices, especially private practices, where you don't have the funds to be able to hire everyone for every little need in the practice. And you ask your staff to wear many hats. You're also trying to find staff, which is really hard right now. I think it's only going to get harder with people being able to work from home, finding different ways of self-income. People are not in the working world anymore, or they're finding other ways. So finding staff and capable staff is another challenge that these providers haven't had to do before. And I do not believe socialized medicine is the answer. I don't believe in socialized medicine for the United States, and that has a very long explanation behind it. But basically, we as a population are not used to it. Yes, we can adapt, but it's just, I think we've passed that point of being able to implement that if we were going to. I don't know what the solution is other than trying to crack down on the people that are exploiting the costs and making things very expensive for the consumers. And that's kind of across the board. It's not just in healthcare. It's just unfortunate that we see it working in healthcare, and we got into healthcare, most of us, to help people. And it's really hard to help people when there's a financial obstacle. And I don't run for politics. I don't run for positions because I don't have an answer and I don't know what the answer is, but I definitely can tell you where I see the problems are. The other thing is we need to go back to caring about patients instead of being focused on all of the incentives that are there to help us get more money. And part of the problem is the reimbursement's really low compared to administrative burden and the overheads. I get it. It's the chicken and the egg thing. But I think that we are definitely going to be going into more value-based care. I think to prepare for it as a practice, you need to be very diligent at making sure your providers are documenting very thoroughly what they're doing, that you have your SOPs and workflows in place based on value-based care, even if you're not getting reimbursed on value-based care and you're still fee for service. I don't think it's a bad idea to kind of approach your patient load, your practices, your everything in the practice, your processes as value-based care, so it will be an easier transition. I think that's going to be a huge thing in the near future. I think telehealth is definitely here to stay, but I don't think it's going to be in the same capacity that it is right now and how easy it is. I think it's going to be less reimbursement. There's going to be a lot more stringent guidelines. There's going to be expectations, and that might be hard for a lot of people to adapt to. And so, but patients are going to want it because now they've had it and they see how easy it is. So it's finding that balance. So definitely utilizing telehealth. I definitely think that patients are seeing the value of telehealth, but it's getting the insurance companies to play into that, and for also providers to not let their care slack because of telehealth and playing into what patients want instead of what's best for the patient, which is huge. And especially when you have a relationship with patients and you go, oh, okay, I know they're really busy, I'll just do telehealth, but your gut's telling you they really should come into the office so you can put your hands on them, run tests, whatever. They need to listen to their gut. And it's really hard when you have that external power. So I think that there's going to be some guidelines that help keep that in check, or I hope there is. If not, I hope practices would do that independently to make sure that there's not going to be any kind of malpractice going on, even though it would be unintentional. Yeah, so that's just kind of my opinion, my thoughts. Again, I think that you should prepare for value-based care. I think that you should not put all your eggs in one basket for telehealth, and I think that you should be very involved with any of your governing societies. So if you're a nurse, with your local nurses association, the National Nurses Association, American Medical Association, the MGMA. I mean, you should be involved in all of those types of organizations because they're the ones that are going to push for lobbying. They're going to be the ones that are going to be trying to get things back on track. And so you need to be involved. You need to be a voice if you want changes made. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was any kind of informational to you. Subscribe to my channel if you haven't already, and please take care of yourself. We'll talk to you next time. Bye-bye.